Hi, this is Matt Kruse, and I'm reviewing case 5560. So this is a PET scan, and we're going to have to change the presentation. Once we open it, we're presented with a single image, such as this one. We're going to change it to two windows. We want one window to have the PET corrected data, the other to have the CT images. And I'd like to change the windowing of the PET a little bit so that the background activity just in the soft tissues is not so bright. About like so. So if we review the images, if we start at the top, one thing that's clear from the beginning is that this is not an FDG or a traditional oncology PET scan. And I know that because the brain has no activity. The brain is an obligate organ that uses glucose, so this cannot be a glucose-based tracer. And in fact, this is a prostate-specific tumor imaging tracer. This one is Pylarify or PYL PET, and it's based on prostate-specific membrane antigen, which is highly overexpressed in prostate cancer cells. There are some areas that have physiologic uptake in the lacrimal and salivary glands here as I scroll down. But basically what we're going to do is go down and look in the area of the prostate and see if we can find this person's primary prostate cancer. You also saw some physiologic uptake in the solid organs in the upper abdomen. So this tracer is excreted into the urine, so there is some activity in the urine, but if we go just below the bladder and look at the prostate, here this is the level of the prostate. The upper portion of the prostate, which is the base, looks fairly normal, but as we go more inferiorly, this is actually the apex of the prostate, we see a focus of intense radiotracer activity in the left prostate. So this is that prostate-specific membrane antigen. This is the original site of the patient's prostate cancer. So this tracer is actually very helpful for looking for metastatic disease. We want to look very closely at any pelvic lymph nodes, external iliac lymph nodes, or obturator lymph nodes. That would be a common site of initial spread of prostate cancer. Also, we're looking for any site of bone metastases. But luckily in this case, we have just the primary tumor in the prostate and no other findings. So that's it for this one. Thanks.